I'm Dr. Genevieve Mellons from Psychology Australia. In this session, I'll be discussing anxiety and phobias. A person with generalised anxiety disorder has feelings of anxiety on most days for at least 6 months, generally about real issues such as finances, illness or family problems. It affects 5% of the population in Australia. The anxiety reaches a point which affects people's everyday lives. For example, Sophie's husband Jerry was often late home from work. Sophie lived in a rented farmhouse and Jerry worked as a labourer in the neighbouring farms. Sophie often had the children in bed before Jerry arrived home. Then she would just sit and wait for him to come. Sometimes he travelled long distances and would not be back before 9 p.m. She often imagined that he had had an accident, hit a cow, or maybe had been injured and couldn't get help, or maybe he'd been taken to hospital. Perhaps he'd even been killed. She became edgy and restless when this happened and developed muscle tension from staring into the darkness, waiting for his lights or the sound of his vehicle. She would often do this for hours at a time. During the day, when the children were at school, she also imagined that they were sick or had some infection. She would sometimes ring the school to check that they were all right. Sophie was quite an anxious person, and not a day passed when she didn't think of something to worry about. She sometimes stayed awake at night, wondering how they were going to pay all their bills on time. She would go through each separate account in her head and imagine that she was paying them all out, but often came to a worrying thought that the money would not go around. Anxiety, like Sophie's, is a common condition and is very treatable. If you think that you or someone you care about may be suffering from anxiety, then I encourage you to chat to a psychologist. Let's talk about phobias. Phobias are feelings of fear about particular objects or situations. Common phobias include social phobia, fear of social situations; agoraphobia, fear of open spaces such as parks and big shopping centres; claustrophobia, fear of small spaces such as lifts, aeroplanes and crowded rooms; zoophobia, fear of animals; acrophobia, fear of heights; and mesophobia, fear of dirt and germs in places such as toilets and kitchens. People often have more than one phobia. Approximately 9% of people in Australia experience a phobia at some time in their lives. Phobias are twice as common in women as in men, and they can start at any age. Take Patrick, for instance. He was afraid of heights. He couldn't remember when it started, but he couldn't climb a ladder on the roof with the other kids when he was 14. He didn't like going up in lifts. He couldn't climb trees because he was too afraid to look down. His grandfather had asked him to help him put up a ceiling one day, but Patrick felt extremely embarrassed because he couldn't stand on the low ladder to hold the ceiling sheets in place. Fortunately, his grandfather understood and made an appointment to see a psychologist who helped him face his fears. That's all for this session. Thanks for listening. If you think that you or someone you care about may be suffering from anxiety or a phobia, then I encourage you to chat to a psychologist. There's contact details for local psychologists and lots more free helpful information on the Psychology Australia website.